And this is a perfect slide because I am the Detroit ambassador for the Fibroid Foundation. And the purpose of me being here today is just to share a different side. Share the side of a woman who has dealt with fibroids for a very, very long time. And since we were talking about mental health, I want to sort of talk about the mental health side of it. My mother had fibroids. My aunt, all of my aunties, all of my mom's sisters had fibroids. All of my mom's mom had fibroids. My sister has fibroids, and all of my cousins. Just in my family, just every woman that I can think of. There's not one female cousin or family member that hasn't dealt with it. Maybe they didn't deal with it at the level I dealt with it, but they had it. So my story started in my early 20s. In my early 30s, maybe 31, 32. I was having symptoms. I was on my cycle more than once, which is too much, too many times. And I'm thinking, okay, what's going on? I didn't know. And when you're that young, I was super healthy, and so I'm thinking, okay, whatever. But when it was happening over and over and over again, I was getting tired, I was having back pain, I was having symptoms. I went to the doctor, and they said, I think you have fibroids. But mine were large enough where they could feel my fibroids. Sometimes you can't feel them, so, I have research from the Fibroid Foundation that sometimes it takes women going to the doctor or seeing different healthcare providers 3 times before they're diagnosed, okay? So I found out, and now I have to make a decision. Because I was having issues, I didn't want to have a blood transfusion. Are you going to have a hysterectomy? I'm 30. I haven't had kids. What are you talking about, a hysterectomy? This is a very depressing conversation as a woman to have. You're young, you're in your youth, and you're having this conversation. And still, I didn't know anything about it. And when you're that young, you don't know anything about it. Of course, you're going to listen to doctors. Of course, you're not going to really understand. So every time I went to the doctor, the only information I received was a hysterectomy. Why is everyone telling me to have a hysterectomy? I'm telling these doctors, I have not had kids. You're telling me to have a hysterectomy. I do not understand this. So life goes on. So I ended up learning about a myomastectomy, and that's what I had, where I was, correct me if I'm wrong, I think I was able to keep basically all my organs for my womb, basically, okay, for the myomastectomy. That was great, 7 years free of fibroids. I remember having that surgery and the doctor telling me when I woke up from surgery, 1, you almost had a blood transfusion because the surgery should have taken only 4 hours. I was on the table for 8. And then the second thing is we couldn't get all the fibroids, which means they're still there and they're going to grow. So I'm like, oh my gosh, but it brought me 7 years. Then they came back with a vengeance. They came back with a vengeance. Now I have them again, and this time I found out I was rushed to the ER because, and I don't have the proper medical term, but part of having fibroids, if they're depending on where they're located, mine were located on my bladder, pushing on my bladder, which caused frequent urination. That's another thing that can be very depressing. Just imagine ready to go on vacation with your friends, and you have to keep going to the bathroom in the group. That's embarrassing. So that's another thing that's, I'm just trying to share the mental part of this, okay? So you don't want to be that one person that's in the car, can you stop again? I need to run it. So that's another thing. But another thing was, and again, I don't know the term, it's where your bladder feels and you can't go. Retention. I could not go, but I had to go, but I could not go. And that landed me in the ER in Chicago on vacation. So I'm telling you, it's a lot to go through this. So then I decided I would have another procedure because I wanted a minimum invasive procedure, which was called a radiofrequency ablation. I was told that should shrink the fibroids, where they're not going to go away, but if it shrinks it by 60 to 70%, it would relieve the fibroids from being on my bladder and make the symptoms better. At that point, I'm moving to an age where I'm like, okay, I'm okay with the whole childbearing thing, because every time you go through a procedure, my doctors told me there could be scar tissue. Scar tissue, which can cause you not to be able to bear a child, because now you have the scar tissue there. So I went through that procedure. It did not work. It did not work at all. I think it shrunk the fibroids by 10%. This was like a $19,000 surgery, and it only shrunk it by 10% because you go in there with the risk of not knowing. But the biggest thing I want to leave you with, I want to share a story. I want you to imagine, and again, this is the mental health part of this. I'm going to see my OBGYN, and this may be helpful for any doctor. I'm going to see my OBGYN. My stomach is distorted because I have big fibroids. I'm in the waiting room with women that have life in their bellies, ready to get an ultrasound. This is my ultrasound day. But I'm not going to get an ultrasound of life. I'm going to get an ultrasound of a tumor. And I remember having to sit in the waiting room almost in tears, like, oh, this is so unfair. And I remember having to lay on the table and they get ready to do the ultrasound and they're like, okay, measuring the tumor. And I'm thinking, oh my gosh, so that's another experience. There's a lot of, again, trying to just share the mental side of it, because women of all races, but especially black women, are going through this, but they're not going to talk about it. No one talked to me about this. My mom didn't talk to me about it. My aunts, no one just talked about or said or gave me a hug to say, I'm so sorry that you're having to have these conversations, because to them, they're like, oh, just get a hysterectomy. I had to get a hysterectomy because my mother got a hysterectomy. But at that point, she had already had us. She had 3 kids. She didn't care. She was like, okay, I'm good. Take it. I'm happy to get rid of it. But for the women who are young or even older and still want to have children, it can be devastating, or just the symptoms can be devastating, embarrassing. It does slow down your life. And then there's a lot of decisions that have to be made, scary decisions that have to be made, and knowing that unless you get a hysterectomy, they can grow back. And then the last thing I want to leave is make sure you do a lot of research, which you could do through the Fibroid Foundation. Do your research, know what questions to ask. Do not just accept a hysterectomy. That's not always the answer. There may be other options out there for you, or if you know someone that's dealing with it that's here, that you can share that with them. And then make sure you're diagnosed right. I did hear a case where a woman was told she had fibroids, but it was something else. It was not, it was an actual like cancer or something.
Sarcoma.
So yeah, so sometimes you can even be diagnosed the wrong way. But that is my experience, and thank you.
Thank you all so much. Ms. Armstrong, I know you mentioned that one of the procedures you had was about $19,000.
Yeah, around that.
Around $19,000. That's one of the procedures
Yes,
that you had.
around
And
that.
it didn't necessarily do what you wanted it to do.
I thank God I have insurance, but still my copay, it was still, for that, on that, it was still high. But there are women that don't have insurance, and it's expensive.
And that's what I was going to ask about. You know, are we seeing that the cost of these procedures are one of the main drivers, one of the prohibitions, one of the things that prevent women from getting either the testing or the treatment that is necessary, and particularly black women?
I don't think it's the cost is, I think there are multiple factors, as we've all talked about, and I just want to thank Tracy for her testimony, because this is a vulnerable story. She gave the perspective of the decision-making at such a young age, the concern with loss of your fertility, the mental health that goes into it, the fact that sometimes in our communities, we as black folk don't talk about our histories enough. We don't share. We should be sharing at the Sunday table about our family histories, our genetic histories, so that we know what risk factors we're at. So I just really appreciate your testimony. because this is the example of what I see every single day. I think as you stay, I have a lot of patients that come to me who say, I'm frustrated because the only option I've been given is hysterectomy. So they feel as though not being heard in terms of alternatives. Sometimes patients have not even been given the example of some of the alternatives that we've talked about. They haven't been educated on, informed on ablation or medications. Unfortunately, we know that there's disparities in healthcare providers, and as a Black physician, I say, has anyone sat down and talked to you about all the options? Some of the concerns is we do often present later, and that may be due to factors. We're busy, we're working, we think this is normal until it becomes not normal. I had a patient just come in the other day. She said the only reason she went in is because she passed out at work, you know? So we're busy, we're afraid. Historically, we're afraid of what the answer is gonna be, and if you don't have that right physician who's listening to your symptoms, then as Tracy stated, you feel like you come out the visit with the only option is hysterectomy. So I think there's so many factors in why patients delay treatment or even diagnosed late.
I might actually tag on to that a little bit about making it convenient for patients to seek the care they need. So women carry the burden of so much in our society, right? You're caring for children, you're working, you're caring elder care, right? So say you don't even have a GYN, right? And so say you go see your family provider, your internal medicine, they're gonna say, heavy bleeding, okay, I'm gonna send you for an ultrasound. Well, ultrasound, when is ultrasound open? 9 to 5, Monday through Friday? We need health systems, providers need to meet patients halfway. If we want to care for women, we need to do it in a way that is patient-centered and really women can really seek the care that they need. So,
And I have a quick stat here. It says the overall economic burden of symptomatic fibroids is estimated to be 5.9 to 34.4 billion USD annually in both direct costs. That's with the medication, inpatient, outpatient visits, surgery, and then also just loss of work.
and those are old numbers
Yeah.
too.
Okay,
So you
so
know
it's
those are the most recent numbers,
Okay.
but they're old. So
Okay.
consider that
Gotcha.
the floor of
Yes,
that number.
okay.
Wow. And so, I brought again the subject before us because, I had heard several times, many of the women in my life, and I've had the surgery and didn't think about it. As you get older, I hear older women talking about it, but it doesn't sound like, Tracy, to your point, that moms are necessarily having these conversations with their daughters. How do we begin to have those conversations within our community at a much earlier age? I'm real big on managing expectations, right? And we should certainly be able to work on managing the expectation for those that are closest to us about what life should look like and be like for them.
I think just what you're doing here today, this is perfect, having a community of people coming in and just having an open forum to start.
I agree, Councilman Tate. I think we don't have very many sessions like this. I've done some sessions in, church and sorority where we have, like Zoom meetings, but also I just think we have to be way more comfortable at talking to our children, our community children, all of those collective in our circles about what's normal versus not normal, and our personal experiences, because sometimes things are just kept such secret that people don't even know what their moms and aunts and cousins have gone through.
And Dr. Thomas, I mentioned that a close friend of mine passed on the operation table. How often? We talk about the mortality rate, and I don't know anything about her past medical history and things of that nature, but I had never heard of someone going through this surgery and not coming out on the other end. How often does that happen? Is that something that is more common than we know of?
No, and that was a very, very unfortunate situation. not knowing the details of the circumstances. Mortality related to gynecological surgery is extremely low, is extremely low. I don't ever say surgeries are routine, because they're routine until they're not, so I don't use that terminology with my patients. But mortality from a gynecological procedure is less than 0.1%. It's very, very low. We don't see mortality.
Could I ask you to comment? Do you have patients that need surgery, but maybe you have to prep them, they can't have surgery immediately because they're not healthy enough at that time?
Yes.
Like low hemoglobin,
Yeah.
and can you maybe discuss that a little bit about who is a good candidate for surgery?
So, good question. There's a lot of times patients come to you and they've been in the emergency room, their blood count or iron level is really, really low. They've gotten, like we say, squared away with blood, but they're still bleeding. So it's a cycle. You got to break the cycle at some point. So oftentimes I say, we're not medically ready for surgery right now. We need a 3 to 6 month window. There are medications that we can do, injectables, to try to acutely stop the bleeding. Once you stop the bleeding, you start to break the cycle. We can also do iron infusions to build you up. We try to encourage patients to be at their optimal health. If you're smoking, stop, smoke in preparation for surgery. Stop smoking, lose that 10 pounds. Everything that we can do, get your blood pressure under control. If you're diabetic, we don't want to risk infection. Get your A1C, your blood sugars under control. So we try to do what we call medically optimize you for the preparation of surgery.
And I promise y'all, I'm coming out for questions, but this one I'm being a little selfish because I've got some myself. So we talked about having this conversation with women, but as a man, I don't understand any of this stuff until somebody tells me, right? Because I don't experience it personally. How do you think it's best to begin to have these conversations with the men in our lives? When we talk about whether it's the dad who will be affected in one way, when we talk about the husband or boyfriend that will be affected another way, and then when you talk about the son that will be affected in a different way based upon the condition that you have. How do we begin having the conversation with men? Because we don't understand. And some men are repulsed. Anytime you start talking, and I'm being real, anytime you start talking about gynecological issues, men go, I don't want to hear it. So how do we begin having those conversations with the men in our lives?
That's a great question. Great question. I think, I'm going to turn it over to a male, but I think, I have my kids are like, oh my God, if we talk about this one more time, like, oh, please stop talking about GYN stuff. But I think if you're partnered with somebody and you notice that your partner has days and you don't have a point of reference, so she's out of commission for 10 days of the month and she's in extreme pain, or she's modifying vacations and plans, I think bringing it in a loving fashion, hey, is this normal for you? Has this been your baseline, or is this a change? When you're partnered with someone, you're close, you know what their lifestyle is, bringing it up in a fashion that's non-judgmental and saying perhaps if this is not seeming what your perception of, I use the word normal loosely, is bringing it up in a fashion to say, hey, might you want to think about seeing a doctor to see if your pain is out of proportion to what you think it should be. I think that's a good conversation starter.
All right. Going to open up for questions. Any additional questions? I think I've got, saw one over here first.
Thank you so much, ladies. Really enjoying this panel. I have, it doesn't really run in I haven't experienced it too much in my family line, but I do have one relative that is actually going through this right now and just had to have several blood transfusions. And in speaking with her, again, like you talked about, it wasn't even discussed in the family because she didn't bring it up. It's a personal issue. But then when she's bringing it up, it's in the midst of making like major decisions. and everything is coming at you so fast because I'm listening to her testimony. You know, you're faced with like some major things, like, you know, while they're trying to discover what's going on with you, the options that they're putting on the table are so huge. You get what I'm saying? Because you have multiple things going on. How do you navigate with that and be a good support system in the family and give better advice? Or, you know, I'm hearing this now, and I have a medical background, so I know what she's talking about, but when she has to share that, you know, with her children or whatever, how does one navigate? Because, I mean, as she was stating, you know, you got all of a sudden these major things where they're talking about hysterectomy. I mean, she has children already, but, you know, you may want to have other children. You know, so these are like so many life-changing things that are on the table with this. It kind of reminds me even statistically with the birth rate, you know, birthing with African-American women too. Like these two issues seem to be intertwined when you have such a high rate of problems. In my history of learning about in particular black women, our pelvic structure is different. So these things are not even really addressed in the black community. People that don't have a medical background wouldn't even know how to articulate that. How can you have these conversations before you get to this point? You know, you just don't bring it up. Honestly, we're not sitting around at the table having these conversations because it is an intimate moment. So what do you suggest? I know you're bringing this out to the forum now, and I thank you for bringing this up because I'm like, wow, I got a relative going through this actually right now. I mean, she literally had to have like 2 blood transfusions in the hospital. They're talking about IUD, and then next thing you know, she called me like, oh, they may be doing this, you know, hysterectomy. I'm like, what? What's going on? You know, so it's just a lot coming at you at one time. So I don't know if I got you can articulate a question out of that, but how can you have the conversation to make sure they have, like, before they make a major decision, options when it's like, oh, you need to make a choice now kind of thing? You get what I'm saying?
So the biggest thing that helped me was support. Once I found out, like I said, it was very stressful, but when I start talking to other women, and finally, it wasn't that anyone in my family was trying to keep it from me, it's just they didn't talk to me about it, but when I went to them, then my mother started to explain what she went through. For me, what helped me was getting the facts. I think fear, for me, I won't speak on me, comes from not knowing. So if I don't have all the facts, then of course there's going to be a level of fear. So once I got the facts, I think about 4 years ago, I became a Detroit ambassador for the Fibroid Foundation, and then a whole bunch of information opened up. So I'm thinking finding organizations like the Fibroid Foundation, they have a ton of information, and just becoming knowledgeable. And then if you're just sitting around, and if you have, like, I have really good girlfriends, I just talk to them, and they were like, we don't talk about this, and now we're talking about it over dinner, over lunch, and I'm listening to their experience. I'm thinking, wow, I had a friend who, the same thing, she went to the ER, she went home, and then the police were at her door after they got her, I guess they sent her home, I don't know what happened. The sheriff came and said, you got to get back to the hospital right now. So sharing her story, and then it's like, wow, I'm not alone. And I think a lot of women, if they just, I think that's anything, if you're going through anything, if you find that support group, this like-minded people who are going through the same thing you're going through, you just get a sense of peace, relief, just to know it's going to be okay. It's not the end of the world, as you stated. It's you can get through it, basically, and that's what helped me.
I would also ask Dr. Thomas, if I'm coming into your practice, and what are some techniques you use to communicate with a new patient, or I may be hesitant to speak with you about my symptoms? How do you draw that out of them? How do you create an open conversation with your patients?
So, especially when I'm seeing a new patient, I invite them as opposed to asking directed question, depending on what the type of visit is. I say, so what brings you in today, and what are your biggest issues or concerns you want to address? And people, I can brag on my staff. I have a friendly office that I feel make our office very comfortable. So a lot of patients stay, they are comfortable from the front desk to that being brought back to the office. So they already have some sense of comfort in my office, and I do brag on my staff. So, but I open-ended, and then I direct questions with respect to what the issues are. So I let them speak first by allowing them to say what their issues are, what have you been seen and evaluated for this problem before, and what brings you to me? Why are you coming to me for this problem as opposed to other people that you've perhaps visited for the same issue?
And if a woman maybe is not seeing that with her own provider, maybe she wants to find a new provider.
Yeah.
So if you don't ask, you don't get.
Yep.
Yeah. We got a question over here.
First thing, I appreciate you all coming out. I've learned quite a bit in this last half an hour. I think Pro Tem asked the valuable question about how do you guys interact with the men and relationships, and more importantly, I have a daughter. She's 13. I just think that 20, 30 is a little too late to be detecting these things and understanding. Is it an issue with funding for more studies? One of the other things I heard you mention is treating symptoms and not really the issues, lacking that ability. Is it more funding for studies that's needed, and how do we get information really out here? When it comes down to just men, I hear anything that goes on, I feel a little proud, like I did something, you know, so it don't necessarily mean I don't associate it with issues or things, but I think that it's important because, you know, it's a saying, behind every strong man is a strong woman, and I think you guys' story really shows that, that it's not really always understood. What we may perceive as emotions are real issues that's going on, and I think those can be really alleviated with communication at some form. I wouldn't want to find out later on, or, you know, a lot of other things, that this is what's going on, when I could be more of a support on that half as a man. And so I think those are a lot of issues that can be portrayed. Then also, this is not the only thing that black people have issues with. We as black people have to be more informed on what's going on, be more educated, and seek these type of information about our health, our longevity, and our lifestyles, you know. And so I just want to reiterate, I think that it's very important that he brought this seminar here. I'm glad that all you ladies come up, bring your expertise out here to the community, within the community. And once again, behind every strong man, I certainly see there are strong women. So I appreciate all you doctors up there. That shows the strength in and of itself. So I appreciate you all, and just those few little suggestions and questions I had. Thank you.
So the research, yeah, it's the National Institutes of Health does not give enough money towards uterine fibroids. Altogether, it's probably less than $10 million a year. As a reference, breast cancer is approximately 400 million. And I'm not saying it has to be an or, but when you put money into it, like for breast cancer, we've seen improvements in diagnoses, in treatments. So these gray hair, the lines on my face, that's for grant writing. I spend an enormous amount of time grant writing, sleepless nights. I'm writing grants now. But I will not stop. I will not stop. So, because we are not there yet with fibroids. And what's tough is you see a ton of money going to endometriosis. That's a white lady's disease. It's like, but wait, fibroids is way worse and affects way more women, but we have the Fibroid Foundation, we have the White Dress Project advocating. There is a proposal in the House and Senate, the U.S. Senate and the U.S. House, the Stephanie Jones, Tubbs, which would require funding $30 million a year for fibroids research for 5 years. It's not passed. They can't get it passed. So the beauty, if it ever gets passed, it's locked in, and they have to fund that. So if you're ever so inclined to write your congressperson, to write our senators, please do. And so I'll stop there about funding, but as far as you mentioned, you have a 13-year-old daughter. So wouldn't it be awesome if young girls, young boys understood anatomy? What is normal? What is not normal? With their own anatomy. So I think that, we have to fight stigma. We talk about it in this community forum, and we have some young teenage high school students in the room that are probably maybe scarred after this, but right? But maybe in a few years they'll be like, oh, I remember that one afternoon when I heard all about fibroids. So, but please, please keep talking, and only because we have brave women like Tracy, to come and share the important details, and I think that's how we get better.
Yeah, I agree.
We've got one here.
Okay. It's been a long time that I had to have the hysterectomy procedure. And I'm just wondering, since you brought in the men, and at that time, my husband wasn't brought in to sit down with the doctor and to have a conversation as to what may transpire with me and our relationship or anything that's going on. So I'm just wondering, is that brought forward now? Because the men need to be involved as to what will be the expectancy with relationship, anything that's going to transpire with the woman. And also, my doctor asked for my husband to put blood on for the blood transfusion. Blood was drawn for him. So is that done?
So,
I'm a little nervous with what I'm saying.
No. No, thank you. So, I in my practice, I can't speak for what everyone else does. I have a pre-op visit. After the initial conversation, people go home, and it's a lot of information to digest. So I don't expect patients to be able to digest all of that information in that visit. I have them come back for a preoperative visit, and I ask them to bring your support person with you so that we can talk about the nitty-gritty, what to expect on the day of surgery, depending on what type of surgery we're doing, the care of the incision, with driving, showering, preparation of meals. Patients talk about intimacy afterwards. What can I expect? So I personally do that, and people elect to bring that person with them or not. Also in the operating room, I meet the family members, and I've always asked the patient, there's some confidential information sometimes that patients may not want to share. So asking them, what do you want me to share with your family members regarding your health or your surgeries? With respect to having blood on hold, some women will require blood transfusion either during a myomectomy is a procedure where blood loss is higher because you're cutting into the fibroids who have a lot of blood supply. They have a lot of rich blood supply, and once you cut into those fibroids, patients sometimes start to lose blood pretty fast, so sometimes you have to be very quick in terms of repairing where you cut. If we think a patient is going to require blood, we prepare in advance to have blood on hold for that patient. You typically will consent all patients for hysterectomy or myomectomy about the possibility of blood in the event of blood loss that is excessive. It's usually higher for myomectomy than for hysterectomy.
And, you know, we continue to talk about this critically low blood supply that we have within our country, within our city, within our state. So please, 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 we're hearing it again, another reason why we should be donating. Have a question here.
So I just wanted to say I battled fibroids for 20 years. And in talking with one of my very close friends that was older who had had a hysterectomy, it led me to Dr. Michele Thomas, who is transparently my GYN. And when I arrived to Dr. Thomas's office, I was already there. I knew that I wanted to have the hysterectomy because I had done every single thing that they had mentioned on those PowerPoint slides. I had been there and done that. And my experience with Dr. Thomas in her office was just as she said. Everybody was warm, welcoming, friendly. She, as a physician, sat down and talked with me about all options, about my readiness, you know, to have the surgery, to have the hysterectomy. And when I was ready to, she was there with me like a little kid that's riding a bike. And she was just, and has always been for these last 10 years, an excellent physician, excellent bedside manner, just very welcoming. And all the people that come to me, because there are many women that have come to me to say, I have fibroids, I don't know what to do. I send them right on over there to her, and she has been excellent in taking care of them. So thank you, Dr. Thomas, for everything that you do. And I also want to say, although he asked about, you know, what do men do and advice and things of that nature, throughout, you know, our time and being together, Councilman Tate, my husband, has just been, I mean, if you want to learn how to take care of someone as a man and take care of your wife, you know, and going through many of the things that you mentioned, even though he's like, we don't want to hear about it, we don't know, he has been and was excellent. I mean, anything that I needed, he was there, and he was just open and able to communicate. So I think that all the things that have been mentioned are so important, and just know, even though he may not think he's an expert on that, he is, that, you know, having that support is just awesome. And I'm going to be in touch with you, too, because I want to be an ambassador, because it's so important for more of us to see and to hear and to, you know, just know that you're not alone. So thank you.
And thank you, ma'am. Any additional questions? All right, we got one here.
I don't have a question, but I do have a comment from my own life experience. I think I was more prepared, and as well as me preparing my daughter, and now I'm currently working on my granddaughters because of my family history. And so with my grandmother, my great-grandmother, myself, and my daughter, and now I'm having the conversation with my granddaughters, and they're in their 20s. Also, I had the conversation with my sons, and now I got to talk to my grandsons. So I think, like Councilman Tate said, it does help if you talk to your family members or your nephews or your nieces. Everyone needs to be involved in that conversation so that when they have relationships, they know how to handle that situation, because they got to be sensitive to the person when they're going through that process. And it helps if the female has the support of their spouse or significant other. I know I did with my husband, and he was A1. And I have to say that it helps if you do have those discussions regarding your health concerns and your family history, because you will find out a lot of information, things that you didn't even think of would be happening to you. And you think that it's just you, like you said in your description, but it's really other people who are also impacted by those same issues and concerns. So, and thank you so much for coming out, and please come back again, because this is a topic that does need to be discussed again, and hopefully you'll be willing to come back and be here with us. Thank you so much.
Welcome.
We've got one here.
thank you, ladies, so much. I really appreciate your coming out and sharing your experience and your expertise with us. But one thing that my family is doing in our family reunions this year is incorporating not just our genealogy, but our health history.
Wonderful.
And so we're asking who's got this, when did you know, this and that. And so we're getting all the family from around the country, and so you're saying, Aunt Betsy had that too? You know, so we are trying to share that information amongst our families, you know, long cousins that we haven't seen. And we're finding that's very helpful in helping the younger ones and the older ones come together to share their experiences. So that's our way of trying to disseminate this information about our health.
I actually have
Great
a
idea.
question. Do you, how are you doing that? Are you sitting in circles talking? Are you filling out forms
They
together?
have, we have a couple of the younger ones are making out these forms, like checking off, what do you have this? Have you had this? And when did you first notice it? And things like that. And there's questions on there for men too.
That's
You know,
excellent.
so to try to, you know, we're finding out who had prostate cancer and never
Wow.
said anything about it because nobody asked them and they never.
Said-
But now, we're trying to broaden our knowledge of each other's health in addition to our, you know, just who was born where, what happened to you there also.
I think you just gave us all a word today.
That's great.
Any additional questions? We've got one over here.
Actually, not a question. I'm really grateful to Councilmember Tate for having these kinds of programs that really help spread news. When I started working for the city of Detroit in the 1970s, black infant mortality was a scandal here, and it was headline news, and it's still a scandal. The disparities in healthcare really need to be amplified and corrected. And you know, I have to say I'm on my way to a Doctors Against Genocide in Gaza. So we can't silo the funding solely among healthcare issues. We have to look at how we can fund human needs, and certainly this is one of the most important ones.
Thank you, Cheryl. Is there any additional questions? All right, seeing none, I think this was very impactful. Ladies, thank you so much for joining us. Really appreciate you. Ms. Tracy Armstrong, Dr. Michele Thomas, as well as Dr. Ganesa Wagenka. There it is. All right. Thank you, thank you, thank you, thank you, thank you, thank you, thank you several times over.